Hi, I'm Dr. Ron Miller with Pursuit Physiotherapy, and today we're going to go over everything you need to know about hamstring syndrome. Now, this is a hard diagnosis to make. A lot of people mistake it for sciatica or piriformis syndrome. It's more common in runners, and normally after maybe you do an uphill training or a new kind of stairs or bleachers training method, going into some more hip flexion causes an irritation. As you can see here, Josh is a doctoral student from University of Central Florida. He has very tight hips. But a lot of times people will get hamstring syndrome in the hamstring muscle here, and it's not real sciatica or it's not real piriformis syndrome. The best way to treat this, you should not be stretching your hamstrings, okay? You can click on the links below and there's going to be a series of exercises that you can try at home to see if it helps with your hamstring syndrome or your hamstring symptoms. But you need to stop stretching your hamstrings, okay? One of the key exercises of what I really like to do with my patients is doing nerve glides. So Josh is going to demonstrate a L1 extender here. You're going to grab your thigh, point your foot up and hold it there and slowly kick out 5 times for me. This is a basic nerve glide that you can get started with at home. If you have a real case of sciatica, this will flare you up, so you have to stop. This should never increase your symptoms. You should feel just a nice stretch along the hamstring syndrome. But the main point is here, if you do have a true case of hamstring syndrome, you need to stop stretching your hamstrings, okay? What you're gonna do is do some nerve glides. You're gonna modify your running, trying to avoid hills or even overstriding. And then you're gonna start with some basic glute exercises where we'll go over a single leg bridge next. So what I like to do just for this example, let's say he has right hamstring syndrome. So what I want you to do is actually do a single leg bridge and kick out your left. So you're gonna lift up, good, and kick out and hold it and go down. Just hold it for like a second and do a couple sets of 10 of this, maybe 2 or 3 sets of 10. Let's do one more. Lift up, kick out, perfect. Good, and relax. So you should feel that working the glute muscle, not exacerbating or increasing your symptoms, okay? So just a quick review. You know, true hamstring syndrome is a hard case to kind of diagnose. You may need to come in for an evaluation to know whether you really have hamstring syndrome or not. A lot of times, again, it's common misdiagnosed for sciatica and piriformis syndrome. Normally, it happens in runners or athletes that do some sort of hill exercise, bleachers or dancers, that it irritates that attachment of the hamstring muscle. The best thing to start doing for treatment is 1, stop stretching your hamstrings, and 2, start doing some nerve glides. And you can see examples of our treatments that we've done with our home programs if you click on the link below. None of these exercises should make your symptoms worse. If it does make it worse, then you have something else going on. It's not real hamstring syndrome. And then you probably have to give us a call to come in for an evaluation so we can solve that problem for you. So let us know if you have any questions. You can put them in the comment box below or give us a call or a text at 407-494-8835. Thanks.